Welcome to the fifth installment of Jillian's Clinical Corner. So usually in Clinical Corner we discuss teaching a skill and the best practices for doing so. However, this week we're going to do something a little different. This week's topic is error correction. So we will not be talking about teaching a skill, but rather how to correct errors while teaching skills overall. There are many questions when discussing error correction. First, you need to discuss all of the different types. So here are some questions about error correction. Do you represent the SD or provide an error correction, a prompt, to the correct answer? And when doing this, do you provide directions in between and then present the SD again? Do you prompt the correct answer and then move on? Do you prompt the correct answer and then present the SD again to allow for an independent response, or at least a lesser prompt? Do you focus on an error correction procedure, or do you just use errorless teaching? With so many options of what to do, how do we decide? Well, what does the research say? For this segment, I reviewed Rogers and Iwata from 1991, who compared error correction procedures during discrimination training. In this research, 4 error correction procedures were defined. These were the absence of error correction, so where the error correction is essentially ignored or put on extinction, and correct responses received positive praise, so differential reinforcement. The absence of an error correction, similar to the first option, but with an added delay before the next trial was presented. So essentially differential reinforcement, but they added the delay before they presented the next trial. Teacher presentation of discrete events following errors, and that may include response costs for errors or other similar strategies. And then error correction with a certain amount of trials prompted to the correct response. So the researchers here found that across the board, all of the conditions improved skill acquisition, so any of those error correction procedures improved skill acquisition, even during baseline. So during baseline in this research, they used differential reinforcement, and the researchers provided positive reinforcement to correct responses, put incorrect responses on extinction, and even that showed improvement for all learners. There were multiple reasons as to why the researchers believed that all the error correction procedures increased skill acquisition programs for all of the learners, but the short answer is it's most likely learner and maybe even program specific. One other thing I was thinking about while making this segment was the no-no prompt. Has anyone ever used the no-no prompt? It's not saying no and then prompting. It's allowing for 2 errors before providing a prompt. So you present the SD. If the child errors, you say no, or somehow indicate that that answer was incorrect. Then you present the SD again. If the child errors again, you say no, or again indicate that that answer was incorrect. Then you present the same SD again for the 3rd time. During this presentation, you immediately prompt to the correct answer, preventing them from erroring a 3rd time. This actually is a pretty popular method, even though you're possibly letting your client error 2 times before receiving a prompt to the correct response. It doesn't necessarily sound like where you want to go with error correction, but again, what does the research say? For this, I reviewed Leaf, Sheldon, and Sherman, 2010. These researchers compared errorless teaching and the no-no prompt method in 2-choice discrimination learning with children with autism. Ultimately, both procedures increased skill acquisition over baseline for their participants. However, skill acquisition was greater for the skills that were taught with the no-no prompt. The reasons for this, the researchers thought, may be that the participants were getting feedback that they got the answer incorrect, and then a prompt if needed for the correct answer. So even though errorless teaching doesn't allow for any errors, and ultimately also leads to skill acquisition, it doesn't allow for as much independence, and even though the participants potentially made more errors with the no-no prompt, they also made increased skill acquisition over baseline and over the errorless teaching. So as far as answering the questions from the beginning, do you represent the SD? Do you provide an error correction procedure prompt? Do you provide directions in between and then present the SD again? There is lots of research on the topic of error correction, but ultimately, just based on the two that we've reviewed today, it's most likely going to be learner specific and possibly even program specific. There are ways to decide if you should choose errorless teaching. There are ways to decide what type of error correction prompt you should use. And it's best for your specific learner and for your specific program and client and whatever the specific situation is, you look into some of the research that deals with that area specifically. So where do we go from here? Ultimately, the research shows what is most likely best is going to be individualized to your learner and possibly even to the specific program you're working on. If you have a learner that embeds errors in the chain of steps, it might be best to use errorless teaching with a most to least prompt hierarchy. If you have a learner that is successful with error correction, then you most likely will use the error correction procedure that works best for that learner. Across programs, a program in which an error could be detrimental to the learner, such as self-help skills like brushing teeth, errorless teaching might be best. For programs that are discrete trial instruction, an error correction procedure might be most helpful. Thank you guys so much for joining us for another round of Jillian's Clinical Corner.